I know you feel like bedside nursing is the shit. I'm here to tell you that you're correct, you're right, and you should leave bedside nursing. This is going to be a story about how I quit bedside nursing in England. I've been working as a bedside nurse and I moved to the UK in July of 2021, and it wasn't like huge COVID period, but we still had COVID and it was quite deadly at that point. Anyway, I started working in bedside. Actually, as a matter of fact, I was thrown into the COVID ward. I worked in COVID for a little over a year. COVID, flu, and all of that. No, so if you're from back home in Nigeria, we didn't have, not like we didn't have cases of COVID, but like I lived in Enugu and it wasn't like as bad. Back then I was in outpatient and private care, so I was a bit sheltered to the entire COVID situation. And Nigeria is not a place where people go to donate or like, do charity and show up to help out during COVID and all of that. So I didn't do any of those things. So when I got here, I got like thrown into the whole COVID situation, and boy, it was very, very difficult. It was one of the most difficult periods. Justin alone was hell. People were dying left, right, and center. There was such, I mean, like, it wasn't even like peak COVID and it was like this. So you can imagine what it was like when it was actually like peak COVID, and we were dying without even like, it wasn't until later that we understood, or I understood after I did a couple of training, that COVID was like a respiratory sepsis, a sort of sepsis, because it just attacks like your system and all of that. Anyway, so I started working in bedside immediately I got here, and I quickly like got used to like the way things were, and it wasn't like such a shocker for me. And a few years down the line, or a year and a half down the line, this feels like such a long time ago, but I promise you it's not. um a few years down the line, things sort of piped down a little bit more, and it wasn't as horrible as we expected it to be, more or less. We quickly like turned from respiratory ward to a full-on like medical ward. And if you know anything about medical wards, it's really not the best one. It's really not the best. Before I knew it, we went to from being COVID flu to like, went from being a respiratory ward to like a full-on medical ward. And if you're in nursing, and if you know anything about nursing, you understand that medicine is the wild, wild west. Like, it's crazy working in the medical ward. And the way hospital is set up, like, then I didn't really understand why things were the way they were. But it wasn't until I left and started doing something different, which we'll get to that, then I understood why we got the cases we got. We've got all types of cases. We've got mental health cases, especially when they come into the hospital and like we don't have beds, so they tend to push a lot of mental health patients into the general medical wards, pending when they'll be seen by psych, and then they will then be transferred to a mental health bed, or like a mental health facility. So a lot of the things that we struggled with was having like a lot of mental health patients. So we've got like all sorts of patients. Now, the particular reason, I mean, I knew I didn't want to do like bedside nursing for a very long, I've always known that, but at the same time, I sort of didn't have like a plan at the moment. I wasn't really thinking. If I just knew that, okay, down along the line I'm going to look for something else to do. If I was going to stay in nursing, I don't want to be in the ward. And even if I wasn't going to stay in nursing, I knew like my business, I was going to launch my business and start my business. I knew that was going to happen. I just didn't have like a push or a reason to want to leave like immediately. Fast forward to one of the main reasons, like the actual push, the thing that made me want to leave like today, tomorrow. Like I was out, I didn't even care at that point if I was going to be out of a job. I just needed to leave. So it happened on a weekend when um I was working the weekend. I was not in charge in my unit, my previous ward, and I was managing the ward for the weekend. And we had this mental health patient that had like what we call like a cellulitis. It was really really bad. He was a disabled patient, but he was also like a psych patient, known to psych team and all of that, and we're managing this patient in my ward. So we needed to do the wound was really really bad, like it had gotten really really bad, and we needed to dress it. And the type of, it was a PB27 dress. Is it PB27? I think it was PB27 dressing that was supposed to do, and I was like the only one who knew how to do the dressing in the ward. So naturally I had to do the dressing myself, even though I was managing the ward at the time, and technically I didn't have any patients. So I was like, you know what, I'm going to do it. It's not like I have my own patient, so it's just one dressing. Now the dressing was really bad. It was stinking, it was horrible. Someone had to do it. Anyway, we got through doing this, or rather I got through doing this dressing. One of the staff, because the staff who was covering the patient for that day was a bank staff. So bank staff are not, they work for the same hospital, but they are not assigned to the ward. I got on to doing this dressing, and I finished the dressing because it was really really bad. It was smelling, it was just overall like awful, and I was like, I just wanted to get this dressing done and just get on to do other things. Anyway, I finished doing the dressing, and he had like a trouser on. So I finished doing this dressing, and he had these trousers on. He was wearing two of the same trousers. It was a hospital trouser. It wasn't a hospital gown, it was a hospital trouser that has like a top. So it was already dirty. Prior to doing the dressing, we noticed that the wound was leaking, and we needed to like change. Oh, my tummy. We needed to like change the outfit, because there's no hope, there's no point of finish doing the dress when we finish doing the dress and then you still wear the same dirty outfit that the soil that had been soiled from the wound, because the leg was leaking. He hadn't dressed it in like 3-4 days, and this is supposed to be a dressing that should be changed daily. So I asked him if we could change the dressing. He was like, yeah, we could. And initially he was like, no, he doesn't want to change it. Then I explained to him that, oh, we need to change it. We've just dressed your wound. We don't want this contaminating the wound again. It's already dirty. I'll give you a fresh pair of trousers and all of that. So he agrees, like, yes, it's looking all clean. He doesn't want it soiled. He felt like pulling the trousers down was going to soil the outfit. So I explained to him that, okay, I can cut out the trousers since we're already giving you a new pair. It doesn't belong to you, it's hospital property. We just need to get this out and all of that. So I explained to this young man, and after explaining to him, we're like, oh, okay, no problem. It was as if something just switched in him, because when I got the scissors to cut out the trousers and like give him a new pair, he became really really erratic and very violent. He started throwing things at me. He threw like the pillow. He yanked off the call bell, threw that at me like it wasn't enough. He took the jug of water and the cup that he had on top of his table, threw that at me. It was like that wasn't enough. He reached for his clutch, because he uses a clutch. He, like I said, it was a disabled patient as well. He took, like, I hadn't even touched this man. We had agreed we were going to change his trousers. I brought 2 new pairs of trousers because he likes to wear 2. So I brought 2 new pairs of trousers, clean ones, to give him. So we before I knew it, this man grabbed his clutch to throw at me, and that was when I got really mad, and I was like, I'm going to call security if you actually do this again. And next thing I knew, this man spat on me. Nobody has ever treated me in that manner in my entire life. It was like it took, when something happens to you, and when something happens to you and you realize that you have the grace of God in you, because that was all it took. I was ready. I was ready to, like something was about to change. Something was definitely about to happen. I was ready. Anyway, anyway, we called security. One of the rest of the staff, they already heard what was happening, and they called security. And security guys came up. By the time they came up, he then sort of repositioned himself. It was as if his senses came back, and obviously I had left the room. It was in a side room. I've left the room, and I went to wash my face and all of that. I was actually considering leaving and going home. Like, I was done with the shift. I had had it up. Like, there was nothing that was going to make me stay there. Anyway, I was ready to go home because I had had it up to here. I was done. I wasn't going to stay there for the next of the bullshit anymore. So the security guys came, spoke to him, and then he let them change him, cut out the trousers, and then change him. At the end of the day, he still removed the trousers because it was dirty. He knew he didn't want the trousers. He knew that it was dirty. I don't know what happened to him. I don't know what got into his head. I can't explain it. Anyway, I told them that if anything is happening with this man, no one should call me. I'm not going to attend to him. I've been assaulted enough, and I'm not going to take it anymore. So, and I told him to his face, I'm not going to. In fact, I told him, I'm not going to come into your room. I'm not going to look after you. Someone else is going to completely take care of your care. I don't just feel safe being around him. Of course, I did a day text, but if we're being honest, how many times do we get day texts that they are being attended, especially when it's staff that is writing the day text and it's about as patient assaulting a staff? Very rarely do we have those type of day texts being attended to. Anyway, I just left him and I went to wash my face. Obviously, they changed him and the day went on. And I realized that after all of this happened, I went on my break. I wasn't ready to go on my break, but I just had to leave. I just had to leave the ward, and I just needed to gather my thoughts, settle. So many things were going through my head at that time. So I went on my break, and I didn't realize that after a while I just noticed that I was crying. In fact, I didn't realize I was crying. It was one of the support workers that came to ask me, oh, am I all right, is everything okay? And she noticed I was crying, and she just went to make me a cup of tea and sat with me for a while. I didn't realize how much that affected me. And I remember calling one of my friends at that time, and I was really, really down. I was like, you know what? I'm not doing this again. I'm done. I'm leaving. I don't care if I don't have a job or what's going to happen. I just knew that I didn't want to be there anymore, and I was tired of bedside nursing. And that is how I left bedside nursing. A few months after this had happened, I saw an advert for a position to work under the virtual ward, and I just went. I just applied almost immediately. I did the training. I've been seeing it for a while, and before even the position came out, I had to go and do the training. So a few months after this, I saw the virtual ward training, and I went for the training, and it was digital. It was something that I liked. Non-patient contact, still the same hours. My pay wasn't going to cut, because that was something I was also worried about. I was thinking that, oh, if I start doing anything digital and the hours cut short, my pay was also going to get cut short. So I had this singular event was something that like sort of made me fast track every other thing, and I wanted to leave like immediately. So I did the training and I started doing a lot of my bank shifts there, day shifts, night shifts, and they always had like a lot of bank. So I started doing the day shifts, night shifts, and basically got really good. And then when the position came out, I applied and I went for the interview. On the day of the the funny thing was, on the day of the interview I was working, so I my interview was for I think 3 o'clock, so I didn't take a break that day until 3 o'clock. I went on my break. The break is usually 1 hour. So I got there and I told them all that I was on break. I had to use my break time as my interview time. That way I'm not, like I like to organize and I like to plan ahead, so that way everything is still like intact. I'm not losing anything. I don't feel like I have to hurry up or get back to work. Like I just like having a little bit of control. I'm the kind of person that functions when I know that I have like a little bit of control with things. So anyway, I did the interview, I got the job, and that is how I left bedside nursing. Like I left and I didn't look back, because to be honest, there's nothing to look back to. That singular event was something that I feel like sort of changed me completely, and it was just sort of traumatic event. I don't think nurses talk enough about the amount of abuse, nurses and doctors alike. I don't think they talk about the amount of abuse that they experience from patients when they're in bedside nursing. This is your sign to leave bedside nursing if it's stressing you out. People have this misconception that if you're not a bedside nurse, you've not done nursing. There's something, you're not missing anything. You're not missing anything. Okay? Take it from me. I've done bedside and I've done non-bedside. You're not missing anything, okay? The only thing you're missing is stress. And I promise you, in a non-patient contact role, you will still see stress. People always ask me this question, like, oh, now that you're in virtual world, you don't have any patients, you're not doing washes. I bet that's easier. I'm like, it might look easier because there is no physical, you don't have that physical exhaustion, but there's a lot of mental exhaustion, which is even far, if you ask me, is much more than the physical one, because you're just tired, and when you eat something and you rest, you sort of rejuvenate. The mental exhaustion that sometimes even when you rest, it's like your mind is struggling to like turn off, and it can't turn off, to be honest, because you've walked it and walked it and walked it, and it's like it's almost like your mind is on overdrive, which is ridiculous. You're not missing anything when you leave bedside nursing, okay? And besides, I know that there's another misconception that people always like to use when it comes to bedside nursing. Or they tell you, oh, you're going to lose your skill, you're not. That's a lie, okay? They are what? Liars go to hell. Liars pant on fire. If you want to retain your skill, you can book extra shifts at the end of the day. If you don't want to lose your skill, there's a way around it. In England, we cannot, you cannot cope without doing extra shift. If we're being honest, you're not being paid that well, so you will always book an extra shift. And if you're going to book an extra shift, then you might as well book it in the ward, be it a day shift, depending on your workflow. The normal NHS work rota is 37.5 hours in a week, so you get to work sometimes 3 times a week for 2 weeks, and sometimes 4 times a week for 2 weeks. And if you decide that you're going to do one extra shift every week, then you can potentially book the shifts to do day shifts on the wards that you like. Do day shifts on the ward and then do some night shifts. So do like a mix of both day shifts and night shifts just so you can retain your skill if you're so worried about retaining your skill. That's my own opinion. If you feel like you're losing your skill, book a shift somewhere, go there, do your day shift, and obviously you kind of balance it out. So this week you can do a day shift, the other week you can do a night shift, this week day shift, the other shift night shift, just so you keep things in check, you know that you still got the skills, and if you need it, yeah, it's there. But personally, I don't think you're losing anything by leaving the bedside. Bedside is the go-to. Okay? We're not being paid enough for that. We don't talk enough about the amount of abuse that nurses, and not just nurses, doctors, the amount of abuse that we endure in bedside. We always hear about, oh, how patients were mistreated or manhandled, and while all of that is bad, I would never support um nurses or doctors treating patients really bad. But also it's vice versa. There are patients who are absolutely horrible and they treat medical staff really bad. So that is also a different conversation for another day. That's it. That's how I left or quit bedside nursing after, well, like 10 years. I'm going to quickly finish my makeup and show you guys the final look, okay? This is my final look. I hope this video has been interesting. I hope this video sort of motivates someone to make a decision with their career and choose yourself, choose your peace of mind, choose what you love, just make a decision and leave that bedside if that's really what you want to do. I hope you enjoyed this video. Leave me a comment, let me know what you think about it, what you think I should do next, and don't forget to hit the subscribe button. I'll see you in the next one. Bye.